Yeah, go ahead. Yeah, I'm a colleague of Steve Roser. As we mentioned, I'm the head of the American College Advisory Panel for the American College of Surgeons. Steve and I have put on joint panels, as he mentioned, for the last 5 or 6 years. So it's been a great collaboration, and we've really enjoyed that. My particular specialty is craniofacial pediatric plastic surgery at a children's hospital, and we work, of course, with our adult plastic surgeons. Don has a little more a breadth of experience because he has a broader role, and I'll let Don introduce that.
Thanks, Natasha. Thanks to my colleagues. So I'm currently the interim chair of the Department of Surgery at Penn State in Hershey, Pennsylvania. Prior to that, I was chief of the Division of Plastic Surgery. My specialty also is in pediatric plastic surgery, craniomaxillofacial surgery, and cleft lip and palate surgery. How about that as an introduction, Natasha? Do you want to find out how we got where we are?
That was wonderful. Thank you so much. I know that we have spent the first part of this discussing a little bit about the oral and maxillofacial surgeons and their pathway. Would you like to speak a little bit about how medical students can go on to pursue a plastic surgery residency? What does the paradigm look like? And perhaps maybe give a little bit of an inspiration of how you all wanted to pursue it and get involved.
I'm following you.
You want to start, Don?
No, you go ahead.
Yeah. Well, Don and I have both been on the American Board of Plastic Surgery, so we're familiar, and we've also been on the RRC for plastic surgery, so we're very familiar with the process. The process is, as there are two tracks to become a plastic surgeon. One is called the Integrated Residency Program, and one is called the Independent Residency Program. The integrated is a 6-year program that starts right after medical school, or you're eligible right after medical school. And so you apply during your 4th year of medical school. The independent track is one where you complete another residency, whether it could be oral maxillofacial surgery, general surgery, neurosurgery, otolaryngology. All of those are full-fledged prerequisite training, and then you do a 3-year independent track in plastic surgery. So we all sit for the same certifying examination with the American Board of Plastic Surgery, and the requirements are very similar, even though they're two different tracks. Once you complete those, you then have the option of doing a fellowship, and the two RRC or ACGME approved fellowships we have in plastic surgery are craniofacial and pediatrics is one, and then hand is the other. But we have a number of fellowships, whether it be aesthetic, microsurgery, burn is developing, wound care is developing. So there are a number of fellowships you can do, but they're not under ACGME accreditation. Don, I'll let you fill in.
So I'm going to kick off and tell you how I got interested and how I ended up as a plastic surgeon. I completed a dental degree first, and my grandfather was a dentist. He was one of the 3 dentists that founded the dental school in South Africa, the first on the African continent. So I was, as a young kid thinking, I wonder, what do I want to be? I was interested in healthcare. Well, I wanted to be like Granddad. So I went into dentistry, and our training involved rotations on a number of medical areas. And it was those things that really got me, that really stimulated me. And a 10-week rotation on general surgery and another one on internal medicine convinced me that that's the path that I wanted to follow. And my grandfather was fully supportive of it. And I figured I'd finish dentistry before going on to completing a medical degree. And when it came time to choosing a specialty, I actually was going to I was going to be an orthopedic surgeon. And I had 6 months to fill in. So I trained in the British system. I had 6 months to fill in. And a colleague of mine was doing orthopedic surgery, had been a dentist. And I said, you know, what do I do for the 6 months? He said, do a rotation in plastic surgery. And I thought, why? Those guys just do cosmetics, you know? Nobody knows what the hell they do, really. And it was like this whole world opened up. We did hand surgery, we did cleft lip and palate, facial fractures, trauma, and I was sold. And it was at a time, so I trained at a time where microsurgery was just coming into its own. And working with general and ENT surgeons, we were doing the early head and neck reconstructions. Some of the early descriptions of using the fibula, and before that using iliac crest, which Ian Taylor had described. It was a heady time. So that's how I got into it, you know. And I was just thinking about Dr. Ferguson's comment about facial transplants. I think that if we think about plastic surgery, it's a specialty that has no defined anatomy. We're all over the place. We're like the modern surgical troubleshooters. When someone gets into trouble somewhere, you're very likely to be called to help out. And it was a plastic surgeon who won the Nobel Prize for his work in transplantation. The first kidney transplant was done by Joe Murray from Boston. He actually subsequently ended up focusing on craniofacial surgery. And it was fascinating to see when composite tissue allotransplantation, so hand transplants, and now face transplants came to the fore and became a practical solution for some of these terrible injuries. It was plastic surgeons who did it. And, you know, we do understand occlusion. If you look at Ed Rodriguez at NYU, he's also got a dual degree. I don't think you need a degree in dentistry to learn occlusion, but the broader outlook and the willingness and to take on the challenge of doing composite tissue allotransplant like a facelift was done by plastic surgeons. I'll hand over to Arun.
Yeah, so as Don said, it's a very rich specialty, and I would encourage all of you who are on the call, who are medical students, to consider our oldest organization in plastic surgery is called the American Association of Plastic Surgeons, and Don has just completed his term as president. It's going to go into its 100th year, and the reason it's so significant is that's the age of our specialty. In 1921, when the American Association of Plastic Surgeons formed, there was no specialty plastic surgery. A lot of it was innovated by people like Kazanjian, who he had a degree in dentistry, and then they began doing the war injuries and going to maxillofacial trauma, and they started developing this specialty that became plastic surgery. And if you are able to go to that meeting, the reason I bring it up to the medical students is we have a scholarship. It's called the Cannon Scholarship. And if you go to the website of the American Association of Plastic Surgeons, you'll see that scholarship. I think you can apply until December 1st. We sponsor students to come and see the best of our specialty. And this is going to be a particularly important meeting because it's the 100-year anniversary. We'll be talking about the history of the specialty, and we're actually going to be putting out a book that outlines how our specialty developed in parallel with all of the great developments in the last century. So I'd encourage you to consider that. But the history of plastic surgery is really very, very rich. And this is the time that you can see how all of the facets that Don just talked about intertwined and developed what we consider to be a premier specialty.
It's a really, truly amazing to hear the history, and congratulations. That's huge. And really something that also resonated with me was your description about how innovative you are, and kind of figuring out things. You don't necessarily have a path. And one of the examples, and just in what I do every day, is necrotizing soft tissue infections. We can take away dead tissue, but just the reconstruction that comes next, and to watch what our plastic surgery colleagues do to really give somebody's life back is it's just incredible. We have a question from one of our students. What factors should students consider when deciding between integrated plastics versus general surgery and the independent plastics program? I don't know who wants to take this question, Dr. Gosain or Dr. Mackay.
Go ahead, Rune.
Yeah.
Follow you.
Well, my feeling is that if you know, the key is knowing what you want to do and when that decision is made. If you're a medical student and you know you want to pursue plastic surgery, I think it's a great venue to go into the integrated track. Don and I didn't train through that track. We went through the more traditional tracks where we completed another residency, had a chance to learn what plastic surgery was, and went on and did plastic surgery thereafter. That was the traditional track. It's only been in the last 15 years or so that the integrated track has really blossomed. So there are pluses and minuses of that. The pluses that you can get into that track sooner, you're involved in that thought process sooner. The negative is that it tends to force you to make a decision early, because the specialty is so competitive that we find that students who are looking for that integrated track tend to know what they want to do by the time they're a second-year medical student, latest maybe an early third-year medical student, because they spend their fourth year doing rotations and trying to impress people that they're competitive. So that has pluses and minuses. We as educators don't actually like that, but it's the reality of the application process. If you're not certain and you really want to get the most out of medical school, you want to see what is going to, what are the challenges the other surgical specialties have, then I would say consider the independent track, because that's the chance you can explore. A lot of our current leaders, in fact, just about all of our current leaders, Don and my age and around our age, went through that process, and we wouldn't have the leaders we have had they not had a chance to see what all of the surgical specialties are. So I would say both tracks are certainly great. If you made your decision early, then you have to, there is a sacrifice. You're going to cut out some of the things you might do as a fourth year student. We don't encourage that, but we find a lot of our students end up doing that. So I think either way is an option. Don, your thoughts?
So Natasha, what I would say to all the medical students on this webinar is, don't be in a hurry to get to where we are. All of us took a lot longer than you realize. And you really need to enjoy the journey. Mm-hmm. There are times, having done dentistry, then medicine, and I've got qualifications on 3 continents now. When I look back on it, they were some of the most interesting times of my life. The one thing I didn't have, and it's the least important, is money. And it sounds like I'm a nut. I promise you it's true. The other thing is, nothing's wasted. I have been a strong proponent of keeping a broad training of surgery in general, even in the integrated plastic surgery program. And certainly if you complete a general surgery training beforehand, there are things that you will learn in minimally invasive surgery, in vascular surgery, that you'll bring back to plastic surgery that will continue to enrich us. We talked a little bit about composite tissue allotransplantation. There's a reason that hand transplants were not done by orthopedic surgeons. It's because they've narrowed their training. And in many cases, they don't even get exposed to transplant. And transplanting a hand is not a technical exercise. And the same thing is true of face transplants. The ENTs didn't get involved in it. It was plastic surgeons who'd done a broad general surgery training and had transplant experience that could see the possibility. So whatever it is, don't think that anything that you're doing is wasted. And you're going to arrive at what you do soon enough. And one of my professors of surgery in South Africa said, why are you in such a rush? How many years do you want to get up and go and do the same thing every day? Now, I think he had a boring job. Quite honestly, I'd continue for another 40 years doing what I'm doing. It's just every day is different and it's an amazing challenge. So don't be in a hurry, enjoy the journey, and nothing is wasted.
I think that's amazing advice and very true. And I'm still on my journey. And so thank you for that as well for me. Another question that has come up. Somebody has said that an attending at my school suggested that independent track spots are decreasing every year and may continue to go away in the next 5 to 10 years. Do you see this trend in your settings, and do you think this is true?
So let me just go. Yes, they're decreasing. I think that we all recognize that we can do the job of training a plastic surgeon more efficiently in an integrated training, but there are some significant leaders who firmly believe that you have to have a full training in some other specialty. There are a lot of big programs that maintain independent spots. There will always be that track.
And just to comment on that, so the ideal a large program ideally would have both tracks within it, and a lot of program directors are set on maintaining that. So I think that won't go away. The other thing is the financial reality is that when a training program has to assume X number of residents per year for 6 years, they have to have the financial resources to do so. Whereas if they assume X number of residents per year for 3 years, they don't need that same commitment by the institution. So many of the programs financially will be on the track to maintain independent programs. So I think, and that'll often be the smaller programs, but ideally the large programs will have the perspective to maintain both. So I don't see the independent track going away, but as you have pointed out, there have been fewer spots. But I think that they will be maintained. So just to give you a perspective, there are 99 institutions in the country with plastic surgery training programs. There are about 135 programs. So it's divided about 85 integrated and 60 independent is the way it works right now, what the RRC most recently reported. So that's starting to stabilize. I don't see that that's going to drop as rapidly as the question and answer did in the chat.
So Natasha, if I could just put an exclamation mark on that. My son just completed his training in plastic surgery at the University of Pennsylvania. So he went through a much constricted training compared to mine or Arun's, and is currently doing a craniofacial fellowship at Stanford, but combining it with a kind of a business centered bio-design course that they run at Stanford as well. So, you know, lots of opportunity in a whole lot of different fields that are going to make us better in the end.
Thank you. I think that we focus a lot on how to be competitive in order to join a plastic surgery residency. Would you give any advice to our medical students on what they should be doing in order to be competitive for application to plastic surgery programs, whether independent or through the integrated?
Arun?
Yeah, so I think the most important thing is good mentorship. So we have an organization, and Don knows he's recently been the president of this as well, the American Council of Academic Plastic Surgeons, or ACAPS. That organization is focused on directing medical students so they understand our resources, understand our application process, and can take best advantage of the whole scenario. You can go to the website ACAPS, but what we emphasize is that we want all students, you can be student members of ACAPS, and that'll get you familiar with it, but we want all students to have a mentor. And if you don't have that, ACAPS will help set that up if you're at a program that doesn't have a training program. So my particular feeling is a good mentor who's established in plastic surgery can direct you to the proper resources. And one of those resources is research and innovation. It's not a requirement, but if that's an interest of yours, I think it's great to get involved in the medical student years.
I mean, that's an awesome question, Natasha. And, you know, for the most part, it's an intensely competitive field to get into. And for too long, the applications have kind of looked like a beauty contest. You know, how many publications have you done? How many committees on your, you know, what are you doing to save the planet? And it goes on and on. And it is disadvantaged because most of the folks that can get that are in fact very well off medical students. And we disadvantage a lot of the folks who can't take advantage of that sort of thing. And Arun and I just have come back from our national meeting where this topic, mentoring and how do you best get into a program, made us rethink everything. You know, the scores are only, the USMLE is going to be a pass-fail this year. My concern is that we're then going to go to the next thing, which is the number of papers you've published. And if you're a medical student who can afford to take a year off for research and rack up the publications, you have a huge advantage over people that just simply cannot afford to do that. So we're rethinking everything, you know.
Thank you for that answer. It seems that it is a work in progress, and a lot of students also want to know, what is life like for a plastic surgeon? And both you, Dr. Mackay, Dr. Gossain, you have amazing careers. Obviously, you've been through it all, and you're sort of in that tenured professor and seen it all. But what would you tell students on the line of that mentorship and seeing what is life for a plastic surgeon as they're making these decisions, and perhaps trying to be more competitive and getting their applications ready for the match?
So one comment, as I look at all the questions that are appearing in the Q&A, it's all the nuts and bolts of how to get into plastic surgery. That's really not what we think our field is. Certainly you've got to get in to do the field, but it has to be a passion for the field. The first thing is see, shadow or go with a mentor who you respect, who you can then track some of their activities, and then see how you can contribute to those activities. That's the best way to make a good applicant. And I actually don't like all these questions about how to get into the specialty. I think the more important thing is, what does the specialty do? How do you know that that's going to be the best fit for you? And how can you contribute? I think those are the questions we should be asking.
So Natasha, I've got a slightly different outlook on that. I just do something that blows your hair back, you know. And so the other part of it is, I think that it's a difficult decision to make. For me, it came down to, was I going to be an orthopedic surgeon or a plastic surgeon? And I got to tell you, every single surgical rotation I did at medical school, except neurosurgery, I wanted to do that. But I had no idea about plastic surgery, so I just had written that off. When you finally decide on your specialty, make it yours. Mm-hmm. Own it. Give it everything. and you'll get much more back in return. I think I could have been a happy orthopod. I could have been a happy ENT. I'm a really, really happy plastic surgeon. And there definitely is sacrifice. It's not, you know, I don't have a 8 to 5 job, and certainly not through my training. But it's the fulfillment of what you're doing. It's something bigger than you that makes up for it. And, you know, your family will see that. There were lots of things that we missed. But if you're okay and you're happy, your family's going to be fine.
And I would underscore what Don said is all the questions of how to be a good applicant. I'd underscore what he said, make it yours and own it. If you do that, you're going to be a good applicant. We as educators, we see students all the time. We can see those who really have a passion for the field. Those are the ones we're going to support and try to recruit into our field. So I think that's more important than your scores or the number of papers you did, is that ownership of the specialty you'd like to go into.
Great advice. I think many of our questions we're going to forego. I think we've answered a lot of these questions, and just like our previous panel, I wanted to wrap up this session with perhaps some pearls of wisdom for our medical students that are listening, and some advice perhaps for them that either you had or you wish you had when you were in their shoes.
Go ahead, Don.
You know, I would just repeat what I've said. Whatever it is you choose, you'll know broadly whether you're going to be a surgeon or not. When you finally decide on your specialty, I hope it's plastic surgery because it's awesome. But just know you're going to have a hell of a career. You're going to have a wonderful time. And you'll have a great life. Go for it.
And my additional comments are, it is so much is dependent on the people you're exposed to, because you might really like one specialty because the people are good to you. You go to another specialty, they may not be as embracing. So it was certainly that each of our experiences is varied based on that, but find the people who support you and you feel like you get along with and maintain those relationships. Don and I have been friends for maybe 30 years now, and we've gone to India, we've done all kinds of things together. Whether you're at the same institution, those are going to be your colleagues and friends for life. So if you find a group that you feel connected to, it doesn't have to be at your institution, and then cultivate those relationships. If in plastic surgery, that's great, and maintain those relationships and become leaders together, which is what that type of relationship does.
So Natasha, one thing, Jennifer Werner, you're absolutely right. There is nothing better than a 2-jaw orthognathic surgery. It's functionally beautiful and aesthetically the best cosmetic operation I ever performed.
Thanks for that, Dr. McKay.
Okay.
Dr. McKay.
Excuse me, McKay. I'm sorry. Excuse me.
It's
My
okay.
apologies.
It's okay.
Well, Dr. Taub, thank you for joining us.
I'm back.
And I know that you have been on some calls, and so we are actually have a little bit of more time. And if you, we are just actually wrapping up our session here. We spent a lot of time talking about the different types of paradigms into getting into plastic surgery, discussing how important mentorship is and really getting inspired and really wanting to do this because you like it, and taking the time to perhaps shadow and work with some plastic surgeons and see if that is what you're interested in, because it is a very innovative and very fulfilling career. So I know that we have a couple of more minutes, and I wanted to hear your thoughts. And sorry if you don't mind introducing yourself as well.
Sure. I apologize for being late. I was on an American Board of Plastic Surgery call. So I'm a plastic surgeon by training. I trained in general surgery first, and then I went on to plastic. So I did an independent pathway. I'm a craniomaxillofacial surgeon. So I did a fellowship in craniomaxillofacial surgery with a gentleman named Henry Kawamoto at UCLA. And I currently serve as the chief of craniomaxillofacial surgery at Mount Sinai Medical Center in New York. Where I'm also the program director for our plastic and reconstructive training program. As far as the ACS is concerned, I'm the current chair of the Advisory Council for Plastic and Maxillofacial Surgery.
Thank you. We discussed a little bit about how did you decide that this was something that you wanted to do, maybe something that inspired you, and perhaps some advice for our medical students interested in plastic surgery.
I think it's the greatest specialty. I think it's so challenging and so much fun. I tell our students at Mount Sinai, it's the one specialty where you're not sort of limited by anything. We work from the top of the head to the bottom of the foot. We're the only specialty that works with hair and bone and skin and muscle and tendon and fat and cartilage and everything else that people are designing in the laboratories, people smarter than myself. There's no boundaries to plastic surgery. It's often said that it's sort of what general surgery used to be. There are so many amazing colleagues doing amazing work in plastic surgery, working with limb transplantation and facial allotransplantation. It's just a wonderful, exciting specialty. The other nice thing is it's not a huge specialty, so most of those in academic plastic surgery know each other and respect each other tremendously. We just came off our big meeting in Atlanta, and it was so nice to see colleagues and friends who you enjoy being with and respect immensely. It's just a wonderful, wonderful specialty. It really is.